Now there are major worries about our state's ability to help you in a medical emergency. Hospitalizations across the state are higher than ever, and some facilities here in Western Washington are nearly at capacity as COVID-19 skyrockets.
Just in the last 90 minutes, the State Department of Health released new numbers in the pandemic. Right now, at least 2,850 people have died from the coronavirus in Washington, up 45 since yesterday's report. More than 10,900 people have been hospitalized, another 34 from yesterday. And there are now more than 170,300 cases statewide, up more than 3,300 in the last 24 hours.
Wow. Tonight we continue our team coverage of the coronavirus pandemic, beginning with KOMO's Kara Kosinich with more on those hospitals nearing their limits. Kara?
Boy, and it is happening, Eric. I have to tell you, at the beginning of November, there were between 400 and 500 people hospitalized across our state. Today, there are more than 1,000.
We are seeing a pretty significant rise in COVID-related hospitalizations across the state.
As COVID-19 cases across Washington soar, more and more patients are in need of care.
And as I look at our numbers, I've got 1, 2, 3, 4, 5, 6 of our facilities right now are in, a critical capacity stance.
At CSI Franciscan's 7 local hospitals, COVID cases are up 175% since the start of November.
We've reached the high mark for our system in the number of COVID-19 patients that we're taking care of.
Numbers are even higher than the spring surge, and it's happening in every corner of Western Washington. Hospitalizations are on the rise from Bellingham to Vancouver.
It is possible that every hospital in the state could get full, and it's happening in other states.
And then there's the concern about fatigue of healthcare workers.
They're past tired.
But hospitals across the state are working together to transfer patients if capacity is reached. But if we see that all over the state, hard and very difficult decisions will have to be made.
Then we choose who gets treatment and who doesn't. The people with the greatest chance of survival get treatment. The people with less chance of survival do not, which means that they will die.
Yeah, Molly, an ICU nurse told me today the next few weeks and months are going to be tough. You heard Eric mention the numbers there. Hospitals are starting to see a rise in COVID-19 cases again now that we're past the Thanksgiving holiday. And nurses expect those numbers to continue to go up with Christmas and New Year's just a few weeks away now. How are you feeling?
We're tired. I'm tired.
The physical and mental toll from the last 9 months wear constantly on Clint Wallace, an ICU nurse in Spokane. He was one of the first to treat COVID-19 patients in our state. He's put in 12 to 16-hour days here, several times per week ever since.
I would love for it to be over soon. I would love for it to be over tomorrow.
The reality is all of the floors that take care of respiratory patients at his hospital are starting to see slow increases, likely a result from the long Thanksgiving holiday. Another rise is expected next month, too, as the country waits for the first COVID-19 vaccines to be made available to the public.
I think we're all seeing the writing on the wall, so the next few weeks and months are going to be difficult.
Like Sacred Heart, UW Medicine is now postponing certain non-urgent surgeries to create space for COVID-19 patients. As of yesterday, the ICU bed capacity at UW Medicine's 4 hospitals was roughly 80%, with 109 patients being treated for coronavirus, up 7 from yesterday. The hospitals released this PSA this week as cases continue to rise. Health experts monitoring the numbers closely statewide to see if people heeded urgent warnings about the risk of Thanksgiving gatherings.
In December at some point, unless something changes, we very well could be in a situation with catastrophic loss of medical care in the state of Washington.
Wallace hopes it does not get to that point. He says continuing to mask up and keep our distance can help.
We all understand that the only way we're going to get through this is by following these guidelines.
Well, Mary Preston, a quick note on those projections. They just came down within the last half hour. And looking at this time through April 1st here in Washington state, that rapid vaccine rollout could save roughly 300 lives. You combine that with that universal mask wearing, 1,200 people spared. And even with a vaccine, it is just the next step in yet another process, with health officials warning this fight is far from over. When it comes to stamping out the COVID-19 pandemic, time will be of the essence.
A large proportion of the population needs to be immunized before transmission is substantially reduced.
Even with a vaccine, we know that it's going to take a while to learn more about the duration of its effectiveness, and there is fear surrounding it and its safety. Health officials say those vaccines that do get approved will be constantly monitored by independent groups scouring over data. Andy Sturgachis serves as the Associate Dean for the University of Washington's School of Pharmacy.
We have mechanisms in place to pick up any sort of concerns that might potentially arise at a later date.
One concern health experts do have is getting people to come back for their second shot a few weeks after that first one. For example, when it comes to the homeless population in King County, some ideas are already being floated.
One thing we're considering is incentivizing returning for the second dose as one strategy to ensure that folks are especially motivated to complete the series.
Mayor, that's right. Targeted arrests or proactive arrests. This idea of police moving in quickly and arresting someone who's created some damage before others can join in. And Mayor Durkan stressed peacefully protesting will always be protected. Vandalism and violence will not. The effectiveness of an arrest. The mayor today said SPD's approach of target arrest during protests is working.
The Seattle Police Department is getting better now at being able to target arrest, to isolate those people in a crowd who are doing the destructive things. We will continue to arrest people for that.
It's a tactic that was highlighted by Lieutenant John Brooks in October.
That has really reduced the level of violence and property destruction in the community.
On Black Friday, 3 demonstrators were arrested. 4 more on Monday, where crowds smashed the windows of the Starbucks and Uncle Ike's Pot Shop in Capitol Hill. Today, SPD told me this year they've made 577 protest-related arrests, including 43 in November alone.
We know, again, it's COVID, so people are not being held very long. And we sometimes see the same people cycling through the system.
The mayor said she's now working with the prosecutor's office to address this rotating door of destructive demonstrators.
At the end of the day, we are now seeing a shift in community as well.
The city is also now working to restore the neighborhoods, feeling the wear of months of contentious crowds. The city has ramped up graffiti and trash removal. The mayor says she hopes to soon reopen Cal Anderson Park and remove the barriers that have surrounded the west and east precincts since August. As protests continue amidst a pandemic, the mayor working to give Seattle its neighborhoods back.
And part of having their neighborhood back means not having these destructive activities night after night after night.
Hi, everybody. Thanks for checking out our YouTube page. I'm meteorologist Shannon O'Donnell from the KOMO weather team. You can see more of our videos right here by clicking on the video links for additional news from the Seattle area and Western Washington. Oh, and don't forget to click the subscribe button below so you don't ever miss our YouTube updates.